The Biden administration has declared monkeypox a public health emergency, working to improve access to treatment and vaccines. But this comes after the New York Times first reported that the Department of Health and Human Services delayed asking the sole monkeypox vaccine manufacturer located in Denmark to bottle its vaccine order, leading to an incredible shortage in supply. This morning, the White House's COVID response coordinator, Dr. Ashish Jha, was asked about it on the Today Show.
I remind people there is one small company in Denmark that makes all the vaccines for the whole world. And we have secured more doses than the rest of the world combined. But we've got to do more. So we're looking at, and we're actually not just looking at, we're working on expanding it to American manufacturers who can make those vaccines.
Joining us now is MSNBC medical contributor and critical care pulmonologist, Dr. Vin Gupta. Dr. Gupta, when did this screw up start? I mean, this goes back years, right? They didn't take it seriously enough because they're worried about smallpox or anthrax or other biomedical, biological attacks, fatal diseases. Or is this Andrea, like they weren't ready for COVID, so they weren't ready for this?
Andrea, good morning. It's always great to see you. There was a slight miscalculation up front, but the announcement yesterday is critical on multiple fronts. And for your viewers here, just to emphasize two key points here. Number one, Dr. Califf, the commissioner of the FDA, announced something that's really interesting, that cutaneous vaccination, Andrea, for your viewers out there who may have had a PPD ever placed to see if they've been exposed to tuberculosis. Similar sort of paradigm for if you're going to get vaccinated with Jynneos, this vaccine for monkeypox, we're going to give it superficially, cutaneously. That actually, if that mode of administration might allow us to extend the existing vaccine supply to 5 times as many people, which is significant. Number two, treatment is now more available to more people through a more streamlined process. Previously, it was bureaucratic. There was a lot of paperwork for good reasons. We need to do a clinical trial. We need data on the effectiveness of TPOXX for sure, this medication that can treat monkeypox, but they're streamlining it. So I do think that there was important movement yesterday, recognizing that things were slow to start with.
And, when did this all start? Are we talking about this administration in the middle of COVID that weren't focused on this, or does it go back a ways?
At least it looks like at least the last few months, Andrea, I would say probably sometime in May is when we had those first cases detected. It would be surprising if maybe there was cases even dating back earlier into the spring. Now, having said that, what's important here is that everybody watching has a plan. And Andrea, I'm going to say this, extend this out to COVID-19 for all your viewers. If you're watching this, if you identify as medically high risk, have a plan. We know that monkeypox primarily has been characterized in communities such as men who have sex with men. Doesn't mean that it's only going to be limited to that community specifically. Colleges, schools, congregate living facilities. We're going to have all of those institutions, Andrea, will have to have a plan. Number one, more testing, but also for Paxlovid. I would love the idea of standing orders for people who need Paxlovid for COVID, that it's already written, it's already prescribed. If they need it, they test positive, they can fill it right away. We need to move towards that as we deal with multiple crises at the same time.